In contrast to males who continue to make new sperm throughout life, females are born with a finite complement of oocytes that are packaged in primordial follicles. This pool of primordial follicles is called the ovarian reserve. Primordial follicles are continuously activated to grow throughout life, progressing through various stages of development to primary, secondary, antral, and finally pre-ovulatory stages. However, most follicles die by an apoptotic process of atresia before reaching the pre-ovulatory stage. Ovarian senescence, or menopause, occurs when all the follicles have either been ovulated or undergone atresia. Therefore, exposure to environmental toxicants or other environmental insults that decrease the size of the primordial follicle pool can lead to earlier onset of ovarian senescence and menopause. Examples include 2-bromopropane, polycyclic aromatic hydrocarbons, anti-cancer drugs, and ionizing radiation. 2-bromopropane was substituted as a non-ozone depleting cleaning solvent in a microelectronics factory. After several months of use, women working with the solvent developed amenorrhea at a high rate. Subsequent clinical investigations revealed that the women had symptoms of early menopause, like hot flashes, along with hormonal profiles consistent with ovarian failure, including high serum luteinizing hormone and follicle-stimulating hormone concentrations, and low estradiol concentrations. These clinical findings are suggestive of a toxicant that destroys primordial follicles, and rodent studies confirmed this. Exposure of rats for 8 hours per day to 2-bromopropane by inhalation resulted in significant decreases in primordial follicle numbers after 17 days of exposure. Eventually, destruction of primordial follicles will result in no more follicles being available for activation and growth. And consistent with this, exposure of rats for 9 weeks to 2-bromopropane dose-dependently depleted not only primordial, but also growing primary and secondary, as well as antral follicles. In contrast to destruction of primordial follicles, destruction of growing follicles causes temporary infertility that can become apparent within a menstrual cycle for the large antral follicles, or may take several months to become apparent if primary or secondary follicles are targeted. Fertility resumes as earlier stage follicles mature and eventually reach the pre-ovulatory stage. This is illustrated by a study in which rats were injected with a single dose of the anti-cancer drug cyclophosphamide on the day of the LH surge. This resulted in a complete depletion of secondary follicles 24 hours later, followed by a complete depletion of small antral follicles at 48 hours. Consistent with the lack of destruction of earlier stage follicles, the number of secondary follicles had nearly recovered by 120 hours, but small antral follicles were still absent at that time, which is slightly longer than the duration of one estrous cycle in rats. The organochlorine insecticide methoxychlor is an example of a toxicant that targets antral follicles without affecting smaller follicles. Treatment of mice with methoxychlor decreased antral follicle numbers and increased antral follicle atresia without affecting less mature follicle stages. When antral follicles were cultured with methoxychlor, follicle growth was inhibited and atresia was increased in a concentration-dependent manner. In practice, many toxicants can affect follicles at multiple stages of development. For example, in women, cancer treatment with cyclophosphamide or ionizing radiation can result in temporary amenorrhea due to destruction of growing follicles, as well as causing premature ovarian failure later in life due to destruction of primordial follicles. The preceding examples support a conclusion that avoiding unnecessary exposure to at least certain environmental chemicals may help to preserve ovarian function and fertility in women.